Right around your 30th birthday, an invisible biological decay process begins. It's called sarcopenia, and it slowly strips away the muscular scaffolding that holds the body upright. Looking at this chart, you can track the exact rate of that decay. We lose between 3 and 8% of our total muscle mass every single decade, and that loss compounds rapidly as we cross into our 60s and 70s. At the cellular level, this goes unnoticed for years, but eventually it manifests in daily life. A degraded core leads to chronic lower back pain. Weakened paraspinal muscles pull the posture forward, and thinning leg muscles create a severe loss of balance. Muscle loss is the mechanical root of physical frailty. It is the primary biological driver behind the loss of physical independence in older adults. The human body follows a strict biological rule for repairing this tissue. Muscle fibers only rebuild when forced to adapt to heavy mechanical resistance. That creates a massive problem for seniors, post-operative patients, and those suffering from arthritis. They desperately need to build new muscle to stabilize their bodies. This diagram illustrates the kinetic chain of traditional exercise, showing exactly why they can't. To load heavy physical weight onto a target muscle, that extreme mechanical stress must first travel down through the body's connecting joints. If your joints are compromised by age, inflammation, or surgery, they cannot handle the load required to stimulate muscle growth. Attempting to lift heavy weights to heal the muscle often results in catastrophic damage to the surrounding cartilage and ligaments. It is a biological trap. The body requires heavy lifting to survive, but it lacks the structural integrity to survive the lifting. To solve this, functional wellness clinics are turning to an FDA-cleared technology called Emsculpt Neo. It is a medical intervention engineered specifically to bypass the joint loading barrier entirely. The process starts with the first of two synchronized energies, radiofrequency heating. When applied to the skin, this RF energy passes safely through the dermal layers and rapidly raises the internal temperature of the target muscle to exactly 40 degrees Celsius. This heat triggers an immediate vascular cascade. The blood vessels dilate, accelerating the delivery of oxygen and dense nutrients directly to the tissue. That same rush of blood circulation actively flushes out lactic acid, which prevents the severe delayed onset soreness that normally follows intense exertion. Within minutes, it creates an artificial, highly optimized clinical warm-up. The tissue is fully prepped for extreme physical stress, all without requiring a single movement from the patient. During normal physical exertion, your brain limits your maximum output to prevent injury, forcing your muscles to relax and rest between every single repetition. Emsculpt Neo uses high-intensity focused electromagnetic energy, or HIFEM+, to completely override those central nervous system safety limits, creating what are known as supramaximal contractions. Instead of activating a small fraction of the muscle group, the device fires signals that engage nearly 100% of the motor units in the targeted area simultaneously. It forces the tissue to contract 20,000 times in a continuous, high-intensity rhythm over a single 30-minute session. All of this massive physiological workload is achieved with absolutely zero joint involvement, strain, or wear and tear on the skeletal frame. This MRI scan shows the thick band of deep abdominal and paraspinal muscle tissue targeted. Deep inside these layers, extreme metabolic stress creates thousands of microscopic tears. To repair this damage, heat shock proteins and satellite stem cells rush directly into the fibers. This triggers a dual growth adaptation. The existing muscle fibers grow significantly thicker, a process called hypertrophy, and brand new muscle fibers are actually born, known as hyperplasia. The technology effectively tricks the body into executing a biologically impossible workout, forcing profound structural adaptation without any physical risk. That microscopic cellular growth translates directly into macroscopic mobility and pain relief for patients who previously had no options. For chronic back pain sufferers, generating new, dense tissue in the deep core acts as an organic internal corset. As you can see in this animation, that muscular corset stabilizes the posture and literally lifts mechanical pressure off of degenerating spinal discs. For aging populations, applying this targeted strengthening to the glutes and quadriceps dramatically restores physical balance, which directly mitigates the risk of fatal falls. And for postoperative patients, it halts disuse atrophy entirely, It keeps the muscles actively engaged and growing, even while a patient is immobilized in a hospital bed. The newly built muscle functions as the body's ultimate shock absorber, protecting vulnerable bones, joints, and nerves from the daily friction of gravity. The muscle wall density captured in this cross-sectional MRI provides the clinical evidence for the internal structural remodeling triggered by the treatment. Modern medicine now has the tools to rebuild the human body's structural foundation, entirely independent of the body's physical limitations. Emsculpt Neo restores functional mobility, eliminates chronic joint pain, and allows patients to fully reclaim their physical independence.